All right, today we're going to dive into something that's really shaking up the world of medicine. We're talking about a huge shift, moving away from the old model of just treating you when you're sick and toward a new, proactive way of actually building and optimizing your health from the ground up.
You know the feeling, right? You wait forever for an appointment, and then you get, maybe 10, 15 minutes with the doctor before you're rushed out the door. It's so common, and it leaves you feeling kind of unheard, maybe even a little lost.
And this quote just hits the nail on the head. It speaks to this feeling that so many of us have, that there has to be a better way than this sort of assembly line approach to our health. So what does that something different actually look like? Let's find out.
Okay, so here's our roadmap. First, we're going to break down the core problem with the current system. Then, we'll get into a whole new philosophy that just flips the script. We'll see how it works in the real world with a specific clinic, check out the cutting-edge tools they're using, and finally, we'll talk about what all this means for you and the future of your health.
So, let's get right to the heart of that frustration we were talking about. See, the modern healthcare system, a lot of the time, is built around volume. It's about seeing as many patients as possible, as quickly as possible. And that can really come at the expense of value, of actual personalized care.
Yeah, that 15-minute visit has become the norm. And this kind of system is fundamentally reactive. It's designed to manage symptoms after they pop up, instead of proactively building a foundation of health to stop them from showing up in the first place. It's a model that's really handcuffed by the way traditional primary care is set up.
So to fix a problem this big, you need more than just a new business plan. You need a completely new philosophy. And that's this shift from something called pathogenesis, which is the study of what causes disease, to something called salutogenesis.
Salutogenesis asks a totally different question. Instead of asking, why do people get sick, it flips it around and asks, what creates and sustains health? What keeps people well? And that one, simple change in perspective, well, it's the foundation for a truly proactive way of thinking about medicine.
And this chart just lays it out perfectly. You see the switch from reactive to proactive, from a system based on volume to one based on value. And this next one is huge, moving from care dictated by insurance companies to a direct relationship between you and your provider. It's not about just managing symptoms anymore. It's about actually optimizing your health.
So what makes this possible? Well, the engine behind this shift is often a model called direct primary care, or DPC. Think of it like a gym membership for your doctor. You pay a flat fee directly to them. This one change is a game changer because it cuts the insurance middleman out of the picture, which allows for longer appointments and a focus on what you actually need, not just what an insurance company will pay for.
So, this all sounds great in theory, but what does it look like in the real world? Well, let's take a look at Althera Alternative Care. It's a clinic founded back in 2019 by Todd and Raquel Lassan, and they are living and breathing this new model.
Okay, so at Althera, a first visit is way more than just taking your blood pressure. They build a complete health baseline using data points that are usually reserved for elite athletes. Things like your VO2 max, which is a massive indicator of cardiovascular health and how long you live. They look at everything from your gut health to your movement patterns to create this incredibly detailed picture of where you are right now.
An approach this data-heavy is only possible because of these huge leaps in technology. Co-owner Todd Lassan talks about his 40-year journey in medicine, starting with his pockets literally stuffed with little reference books. Now that entire library, and honestly the entire world's medical library, is available instantly synthesized by AI. Now this is a super important point. The AI isn't replacing the doctor. No way. It's a powerful tool that supercharges their clinical judgment. It pulls in all the latest peer-reviewed research and evidence right into the exam room, helping them craft a truly personalized plan for you. So, once you have this incredible depth of data and these AI-powered insights, what do you do with it? Well, providers can now use a whole new toolbox of treatments, ones designed not just to fix problems, but to optimize your body's own systems. One of the key tools in this new toolbox is something called peptide therapy. You can think of peptides as these tiny little messengers. They're just small chains of amino acids that our bodies already make to tell our cells what to do, like heal an injury. And because they're basically identical to what's already in our bodies, they work seamlessly and tend to have far fewer side effects.
And the applications are just wild because they work with your body's own natural processes. Peptides can be used to speed up healing, support your immune system, improve your skin, and even help with things like weight management and hormone balance. It's an incredibly diverse tool.
And the list goes on. This proactive model uses all sorts of evidence-based regenerative treatments.
Everything from biologic joint injections that help your body rebuild tissue, to therapies like hormone replacement and shockwave therapy. They're all aimed at one thing: enhancing your body's own amazing ability to heal and thrive.
But for all this incredible technology and mind-blowing science, the future of health really does still come down to the human element. It's about the vision and the passion of the people who are driving this change.
See, Althera wasn't built by some big corporation or a bunch of investors. It's a family business, bootstrapped from day one. Todd and Raquel Lacine built the clinic themselves. I mean, they literally put up the walls, all because they had this crystal clear vision of what healthcare could and should be.
And this quote from Raquel Lacine just says it all, doesn't it? It shows their focus on smart, sustainable growth that's built on patient value, not on expanding as fast as possible. It's all about getting the care exactly right for every single person who walks through their door.
So ultimately, this is the mission, right? The goal is to finally break that cycle of just managing symptoms. It's about using data to figure out your unique health baseline, to know exactly where you stand today, and then using science and personalized care to lift that baseline up, to future-proof your health for the rest of your life.
And that leaves us with a final question for you. We're living in an age where we can measure our bodies in ways we never thought possible. The power is shifting. It's no longer just about fixing what's broken, it's about building what's possible. So how are you going to define and elevate your own health baseline?